Hello, a very warm welcome to General Practice. Congratulations on getting through your exams and joining the exciting, messy, exhausting, yet ultimately very rewarding world in general practice. First, a quick introduction to myself. My name's Rob Walker. I'm one of the NB medical team. I've been a GP for over 15 years now, working in the same practice in Basingstoke, although along the way I have been a locum, a partner, and am now a salaried GP. But alongside that, you hopefully will see me on Times with the NB medical team. I'm quite heavily involved in writing the books, helping out with the course material. You may well see me popping up on the Q&A in the live webinars. And I also write quite regular blogs, which, by the way, are a great way of adding a little bit of CPD to your annual appraisal, which brings me on to my ABCD, the hacks that I think I wish I'd known earlier on in my general practice career, and I've shamelessly lifted the ABCD approach from Philip, who I'm sure you will hear from later or may have heard of before my video. So my A is for appraisal. Now, Rachel's got an excellent section in the New to GP course on appraisal. One of the key things, though, is that you should not need to spend too much time putting together your appraisal material. And one of the hacks that really works for me is getting your CPD, what is now termed your supporting evidence. Try to do that as you go along. Don't try and do it just before your appraisal because it's difficult to dredge up all that information. The way I do it is I just simply have an Excel spreadsheet open on my desktop. I open it as soon as I go into work in the morning. And then anytime I have any bit of learning, whether I've been to an educational meeting, whether there's been a pun or a den, I just quickly jot it down in my spreadsheet. And then later on in the day, just quickly add a bit of information about what you've done and then what your learning points were and any particular reflections. You can then just simply upload that when you get to your appraisal time. It's much quicker and easier that way. The other way of linking up your appraisal learning is via the NB dashboard, whether you use 14Fish or Clarity. That links up straight through to your appraisal platform, which is great. My B is for boundaries. I wish I'd learned this a bit earlier on as a GP. As a new GP, you're desperate to get on the right side of your patients. You want to empathise with them and do the best for them, but it's really important that you keep those boundaries, that you keep that doctor-patient boundary. I made the mistake of allowing a few of my patients to call me by my first name when I started out as a new GP, and 15 years down the line, they're still calling me by my first name, which I have to be honest, feels a little uncomfortable now. So just always have that in the back of your mind in terms of how you're going to develop your relationship with your patients as you go along. Remember, it's not just the next few months or years, it may be many years down the line. C is for coffee, literally the most important break of the day for me. Make sure you have a coffee break, make sure you have a break in the day, and importantly, drag your colleagues up, have a chat with them. You can discuss cases. I learned so much information from my colleagues at coffee breaks when I was a new GP. It was utterly invaluable, and it's such an important part of the day. Finally, my D is for decompression. It is so easy, particularly earlier on in your career, to sometimes have that work dragged home with you. And it's so important that you try to delineate your work and your home life. And this was a little tip that was given to me by our local LMC. So what they recommend you do is, as you're logging off from your long, hard day's work, just think about one thing that went well. Give yourself a really good pat on the back and say, well done for doing that. And then also think about something that maybe didn't go quite so well. Briefly reflect on it, but then park it. Make sure that does not come home with you. If you need to reflect on it or think about it, make sure that happens when you get back into work, not on the way home or when you indeed get back home. Then also importantly, on your way out the door, say thank you to all your colleagues. It's hugely important that we all recognise the hard work that we all put in when we're working in primary care. So thank your colleagues on the way out. It makes a massive difference. And then finally, think about how you're going to decompress and leave work in the workplace. What are you going to look forward to when you get home? Are you going to be cooking a nice meal? Are you going to give your wife or partner or kids a big hug? Or are you going to go and do out something nice, go out for a run or do something for yourself? But make sure that you have something to focus on when you get home that is not work related. That can make a massive difference. Anyway, I look forward to seeing you all in the future in some form or another in one of the NB courses. Good luck.